Hello and welcome to SG Health and Wellness. I am Swati, Doctor of Natural Medicine and Holistic Nutritionist from Minnesota University, Australia. I am also a Yoga Shiromani from the International Shivananda Yoga Vedanta Center. In today's episode, we have the privilege of speaking with Dr. Prashaant Chaudhry, a renowned and the best ophthalmologist in Delhi with over 19 years of experience in the field of eye health and surgery. He is currently associated with Aakash Healthcare, the super specialty hospital in Dwarka, New Delhi, as a senior consultant and HOT. Dr. Chaudhary did his MBBS and MD Ophthalmology at the prestigious All India Institute of Medical Science. He is also a fellow at the International Council of Ophthalmology and has international exposure at the Bascom Palmer Eye Institute, Miami. He is a regular speaker at various national conferences and an author of numerous international peer-reviewed articles and books. Welcome, Dr. Chaudhary. What are some of the most common eye problems seen in children and how are they treated?
Yeah, thank you so much for having me here, Swati. And a very big congratulations for this great show that you're running. And today, let us just talk about a few common things about children, as you asked. Childhood is a very, very important part of life. You understand that in childhood, that is when the body is growing, all parts of the body are growing, including the eye. So during this period, the behavior of the eye is very different from how it is in adults. If an adult is looking at the phone the whole day, it will not cause a power to come in his eye. But if a child whose eye is still in the growth phase is spending a lot of time on the screens, on a mobile phone, on the TV, so naturally his eye will behave differently. So you must have seen after coronavirus, there's so many children wearing glasses. They weren't wearing so many before, but after corona, because of the lockdown, children spend so much time indoors, so much time with gadgets, that has amplified the myopia. So we've already been seeing this. In fact, some studies done even here in Delhi have shown that if you're watching a mobile phone for more than half an hour a day as a child, or 2 hours or more of laptop distance or computer or TV distance, that predisposes you to developing a minus power, a myopia in your eye. And conversely, if you're outdoors for 1 to 2 hours per day, that protects you against myopia. If you go to villages, you won't see children wearing glasses. They don't need glasses. They get up, they go out of the house, and they come back just to eat food, then they go out again. They're outdoors most of the time. Being outdoors and looking far away is protective from wearing glasses, getting myopia. So it is important for children to spend 1 to 2 hours outdoors in daytime with daylight there, and to restrict the use of mobile phones to half an hour a day and other TV and everything to 2 hours a day. That will prevent them from getting a power. And if they do have a power in the first place, it will make sure it doesn't shoot up very fast. So that is one of the most common things in children, that they have an eye problem, they have a power, and it is undetected. So it is important for every child, when they start going to school, to have an eye checkup to see that do they have a glass power or not. And periodically after that, especially if the teacher is noting that the child is unable to see from the last bench, they should have an eye checkup. That brings us to the second problem, which is lazy eye. If a child has a glass power and he wears glasses, his vision develops fully. But if he has a glass power, especially one eye has a glass power, one does not, then he keeps seeing with the good eye, and the eye that has a glass power, and he's not seeing through that because the light is very hazy in the retina. The brain ignores that part of the eye, and he sees only with one eye, and the other eye, the vision doesn't develop. So when we give him the glasses, even then with the glasses, he won't be able to see, because the light is now focusing on the retina, but the part of the brain connected to this retina is not developed. This is called lazy eye, or in our terms, it's called amblyopia. Now, amblyopia can be treated in children. If there is a child less than 7 years of age comes to us with amblyopia, we can give him glasses. If required, some exercises. We have some patching exercises, occlusion, or even some vision therapy, computer vision therapy exercises. With those, we can bring his vision almost to normal vision, 6 by 6. But if the same person comes at the age of 21, there's not much which can be done, because that capacity of the eyes to see is there in children, the capacity of the brain to develop is there in children. After that, it is much lesser. After that, with some vision therapy and the advanced computer things, we can get some vision, but not all of it. So it is important for children to have a routine examination, because even if they're seeing with one eye, they'll never complain. For them, the whole world is probably seeing in the same way. They don't realize that there is something lost. If you have a privilege and you lose it, you'll feel it immediately. But if you never had the privilege, you will never notice its absence. Like my professor used to say, if you hike the pay and then reduce it, there'll be a strike. Because they've had the taste of high pay. If you never hike the salary, there'll be no strike, because they will not feel the absence of that. Another very common problem that we see in children is squint. Now, squinting eyes means that one eye is looking straight, the other is looking slightly inside or outside. Now, what happens is the parent of the child notices a squint, and some elders in the family say that don't treat it now, he's still too small. You should treat it when he starts going for marriage or goes to work or something like that. Now, that is a very, very wrong concept. Why? Because we just discussed children behave differently. Their brains are actually developing. And the 3D vision requires both eyes to see the object at the same time. Now, if one eye is looking here, one eye is looking there, you will never have 3D vision. They have to both look at the same point at the same time. And with that disparity, we get the depth perception. So, if we want the child to develop full 3D vision, to be able to drive confidently, to be able to utilize the 3D technologies which will come way after we are gone, because they're children, they'll be exposed to so much that we cannot even think of. They have to be treated early. They have to have the squint correction done early. In fact, one of the pioneers in strabismus and squint in the whole world, Professor von Nuden, we all read his books as postgraduates. It's a very thick, very good book. His own son had squint, and he operated his own son at 6 months of age. And that son developed full vision with full 3D vision. So that shows the conviction that us as a ophthalmic fraternity have to get the children operated at an early age if the squint is there, so they can get maximum benefit of the squint. It is not risky anymore. Our anesthetist can operate a 3-month-old for a brain condition for 12 hours. And the child comes out of it as though, it was just, he has had a small sleep. They recover very fast. So technology has reached that level, and we should make full use of it. Another very common problem in children is allergies. Allergic, we call it VKC. This is basically due to all the dust, dander, dust mites, pollution in the atmosphere, that they have a little bit of itchiness in the eyes. They have a bit of redness in the eyes. After they have a bath, the eyes become red. You'll notice that they're rubbing their eyes more than they should be. All of those are signs of allergy. Now, allergy may require some medication. It may require some drops to stabilize the allergy, but there are a number of things which can be done even at home. One is cold compresses. Cold reduces inflammation. Splash cold water, you get these gel foam and gel glass shaped things. You put them in the fridge and just wear them for 5 minutes. That coolness is going to help. Or even take a spoon and put in the freezer. The back of the spoon will act as a cold compress. Simple things like that can really help. Second, if the child has this, make sure you clean the house thoroughly while the child is not there. A regular dusting of the house. Take the bed sheets, pillow covers, put them in hot water for some time. Or also, what we can do is sun all the clothes, sun all the linen, and don't use carpets. Make sure the curtains are well washed. All these things go a long way in preventing allergy, because dust mites are one of the most common causes of allergy, and these are where they actually breed, right? Another very common thing that we see in children now is digital eye strain. Gone are the days when computer professionals are the only ones getting it. Now the children are so much on digital devices, that they are also having digitalized strain.
Very early age.
At a very early age, which was unimaginable to us before. So, digitalized strain, again, the treatment for that is take frequent breaks. After you're on the screen for 20 minutes, take a half a minute break, look far away for half a minute, let the eyes relax, blink a few times, then get back to your work. Second, blink more frequently. Normally, when we're staring at a computer, we stop blinking.
Yes.
But naturally, we blink much more frequently.
yes.
In fact, 16 times a minute normally, and 6 times a minute when looking at the device. So, blink more consciously and more frequently. Uh, the other important thing when you're looking at screens is that the posture should be good. You should be sitting straight. You should have the computer under eye level, 15 degrees under eye level, with a good posture of yourself. So that also goes a long way. Have good room lighting. If you open a empty Word document and you put a blank sheet of paper next to you, they should look the same. If the blank sheet of paper is too dull, increase the brightness or reduce the screen brightness. So if they're the same, it is like your screen is part of the room. Then the strain is much less. So those are the things that can be done for that. And one most important thing which I would like to tell, which most children don't have, but still I think general public should know about it, is retinopathy of prematurity. Increasingly nowadays you have children who are born at 28, 30, 32 weeks. 7 months or even 8 months of pregnancy, they're born very, very early and very weak. But our healthcare facilities improved so much that many of them survive. So those children have problems in their retina quite often, and that needs to be tested. And some centers, like, you have pediatricians who are very, very aware of it, and they'll make sure an eye specialist comes to the ICU and sees the baby. Like in our hospital, that happens, but sometimes that doesn't happen. So the parents have to be very vigilant that if the parent and the child is born preterm, they should get the retina checked for ROP. ROP is an extremely, extremely severe disease. If it manifests, it can lead to blindness for life. And the treatment is very easy, just a bit of laser, and they'll have normal vision like both of us. So that is why it is very important, if there is a child born preterm, they should have their eye checkup done. Their parents have to insist that the eye checkup is done of the child by an experienced person looking at ROP. Those are the common things that I could think of, that children should be taken care of, and the parents should take a extra emphasis for these conditions.
Thank you so much, Dr. Chaudhary, for joining us today and sharing your expertise on eye health. I'm sure our listeners have gained so much valuable knowledge from this conversation.